Hey guys, how are you? Dr. Thompson here with Exemplify Health Center, affiliate of the Wellness Way. Happy Wednesday evening, guys. Hope you guys are having a great week coming up to Memorial Day. I wanted to jump on with you guys very quickly. I want to show you some interesting research articles. I'm always reading research and help you kind of glean through some things and what these things actually mean. I'm going to go over with you two research articles today, and I find them very interesting. This actually comes out just a couple of days ago. This comes from the Journal of the American Heart Association. Interestingly enough, title of the article is Short or Long Menstrual Cycles May Increase Heart Disease Risk. Excuse me, that's the first one I want to go over with you. And then the second one I want to go over with you too may not come as a surprise, but came out just a couple of days ago. Is a letter that was published in Journal American Medical Association Network Open, excuse me, called Study, Media Coverage May Influence Prescribing Trends. Oh, who would have thought, right? So let's cover this, help you make a little bit of sense when it comes to hey, what's this whole idea behind short and long menstrual cycles? What does that have to do with anything when it comes to with heart disease? So let me see if I can bring this up and make this a little bit bigger. There we go. Comes out of the Journal of the American Heart Association. So they actually, let me go through this article with you. So short or long menstrual cycles may increase heart attack or heart disease risk. So the key takeaways that come from this is irregular menstrual cycles are associated with cardiovascular risk, and long and short menstrual cycles are associated with atrial fibrillation risk. Short cycles are associated with coronary heart disease and heart attack. Okay. Main thing that you have to understand is what affects a woman's hormones, and then you'll understand how both of these can cause something that's very inflammatory, known as heart disease. This is why it absolutely astounds me that we still have this whole if everything is caused, heart disease is just caused by your LDL. There's a reason why these things are happening, and you have to have an inflammatory trigger. That's why we talk about inflammation, guys, so much. So this came out of Nanfang Hospital, Southern Medical University in China. Okay. So here's what the lead researcher said. Irregular menstrual cycles throughout the reproductive lifespan may be an important risk factor for cardiovascular disease. Here's what's interesting is they say that's a risk factor for cardiovascular disease, as if having a long or short menstrual cycle, that's causing the cardiovascular disease. No, that's a clue that there is something happening that affects both your hormones and also cardiovascular disease. Hopefully, guys, that makes sense. There has to be an underlying cause for both. Not just your menstrual cycle goes out of whack and we don't know why, but oh, by the way, now it's going to put you at a higher risk for heart disease. Well, what is the risk that is involved? Okay. They studied women at 46 years, and then they followed them around for basically about 12 years after that. And here is what they found. So this was a 12-year study, 12 year follow-up. And they studied a fair amount of people. It involved 58,000 women, okay, who didn't have any cardiovascular disease at their baseline of study when they initiated the study. And then the mean age of the women that they studied was at 46 years of age. Okay. Now, here's what they found. Compared with women with regular menstrual cycles. And what's interesting is they define a regular menstrual cycle of basically being from 24 to 32 days, which I would have some problem with that as far as normal menstrual cycle being at 24. The average should be at 28 days plus or minus a day or two. So they gave a lot of leeway in regards to what they would consider a normal menstrual cycle. So compared with regular women with regular menstrual cycles, the hazard ratio or the increased risk for women with irregular menstrual cycles were basically 20% higher for cardiovascular disease events and 40% higher for atrial fibrillation. Okay. Now, in analysis by cycle type compared with women with regular menstrual cycles, the hazard ratios or the increased risk for cardiovascular events were basically 29% increase for women reporting shorter menstrual cycles, 11% for women reporting a long menstrual cycle. Okay. Now, results persisted for women reporting short menstrual cycles after adjustment, even after education, race, history of hypertension, diabetes. So they took all these factors into account. But here's the main takeaway from this is they said that the risk for any cardiovascular disease was more than twofold for women who maintained menstrual cycle irregularity during follow-up. Okay. So basically what they said is it can increase your risk by 2 times. Long or short cycle length are more likely to be associated with increased risk for atrial fibrillation, with hazard ratios of 30% increase for short cycles and 38% increased risk for long cycles. Okay. I wonder if there was in some kind of involvement when it came to nutrient status, when it came to stress levels, when it came to neurological involvement that's going on. But here's their conclusions. We found irregular menstrual cycles were significantly associated with higher risk for atrial fibrillation, suggesting that menstrual cycle dysfunction might be previously an unknown risk factor for atrial fibrillation. Further study is needed to determine the relationship between menstrual cycle characteristics, atrial fibrillation, this large population at high risk. So, and somehow they're telling us that this might be a risk factor for atrial fibrillation, but they're never ever, guys, putting the pieces of the puzzle together. This is also true. There's a study is out there, it's very recent, and they talk about, wow, people with autoimmunity have higher risk for heart disease. And this goes back to the foundation of everything that we teach is that inflammation literally, guys, is the spark that leads to every single thing that is out there. Okay. So if you have something involving the immune system, it can mess up your menstrual cycle. Okay. If you have something involving the immune system, it can cause autoimmunity. And so heart disease, how does menstrual cycle irregularity and autoimmunity, what is the underlying factor with all of this is that it comes down to inflammation. Okay. Now, the other thing is too, is this also could come down to when it comes to mental stress. If a woman has a high amount of mental stress, it can shorten the menstrual cycle. And I want you to think about it. How many times have they linked mental stress to cardiovascular disease? That's why they say, oh, look at this person. This person has got a type A high stress personality who's a driver. They're much more likely to have cardiovascular disease. This is the reason why. Excuse me, but they're not making the link between those two. They're just calling another risk factor without ever trying to figure out that maybe those things actually correlate between the two. Okay. Now, I want to go over with you another one. And this one it's almost comical. All right. And this came out, actually came out today, May 24th, 2023. This comes from the Journal of American Medical Association's Network Open. Title of it is Media Coverage May Influence Prescribing Trends. Who would have thought that, right? You don't have to look very far. This is like saying, that this study does in fact confirm that the sky is in fact blue. You don't have to look very far is where you get your news, where you watch your television, and every third commercial is for a pharmaceutical drug. You know what's interesting is that United States and that New Zealand are the only countries in which pharmaceutical companies are allowed to advertise their pharmaceutical drugs, in which, and if you think about it, in which a person can't prescribe it for themselves. See, the doctor has to prescribe it for them. So why on earth would they need to raise awareness with patients? Because the patients are going to the doctors and saying, hey, I heard about this drug. You think you could prescribe it for me? Well, actually, according to this, they in fact are, which leads me to believe that maybe that how doctors are prescribing medications maybe it's not as scientifically backed and sound as we would be led to believe. So let me bring this up here and let's go over this. Okay. So this is the key takeaways. After a newspaper published an article on low dose oral minoxidil to treat hair loss, which is basically a DHT blocker. You block DHT, the hair follicle doesn't start to thin, although it doesn't get to the reason why your testosterones are converting down into DHT. There's reasons why that happens. And so they say prescriptions significantly increased, even if no new findings are reported with the medication, meaning there's nothing new. It's just they just brought it to the forefront as far as awareness with advertising. Media coverage alone may influence prescribing trends with doctors. Isn't that interesting? So here's what they found. After receiving media attention, prescriptions for minoxidil increased in men by almost 2.5 times and almost 2 times in women. So advertising leads to an increase in prescriptions. Makes you wonder who's running who here. So when you look at this, this is just for one prescription for a hair loss prescription. But they actually found this after the New York Times publication prescribing use of low dose oral minoxidil to treat hair loss. There was an immediate increase in prescribing, despite the fact that the article did not report any new findings or any large scale randomized evidence. There was no better evidence. There was no miracle finding. They just did basically just reported on it, which also makes you wonder too, is that maybe even the pharmaceutical companies are influencing the news, not just advertising, but the news. So basically what they saw is they saw a massive increase when it comes to the media reporting on certain medications and things like that. It just always leads me to believe is why do they need to advertise? Because shouldn't the doctors be in charge of advertising or prescribing drugs based on need, based on labs, and based on clinical findings? But then why on earth would it at all of these increase? Because now there's just more awareness of it. And lo and behold, when they asked for it, they ended up actually getting it. I guarantee you that there wasn't any kind of testing to see if it was actually something that could help them, because you could see on a lab test to see if someone does have elevations of DHT. You know what I would do instead, rather than give them that medication? I would say, let's figure out why your body is down converting your testosterone into DHT that can cause some hair loss. Let's fix that, because that's guaranteed. That's something in relation to lifestyle. And so the point of this, and why I wanted to bring this up, really has to do with this, is look at the influence that we have in media. Look at the influence that we have with advertising and how that plays into our healthcare system. Our healthcare system, in my opinion, is bought and paid for by drug companies. And if they're bought and paid for by drug companies, doctors are no longer doctors. They're just the prescribers for the medications that patients want. And so it's time that we get rid of advertising when it comes to prescription drugs at all. And we need to stop talking about it. And that's a conversation that needs to happen between the patient and the doctor. But also what needs to get better is the conversation between a patient and a doctor on how to improve their life and how to improve their health, rather than throw a bunch of medications at it. And then that's why we see people who come in who have things that are known as polypharmacy, when they're on 6 and 7, 8, 9 different medications, and they don't know why they don't feel very good. A lot of it has to do with the number of medications that they are taking. And I always will tell people is you're happy with healthcare. You'll be happy with healthcare until you get really sick. And so up until that point, it is an illusion until you get very sick. And then you realize adding more drugs is not making me better. And so that's why our healthcare system needs a massive, massive revamp. We need to start looking at causes versus risk factors and not drawing the dots or not connecting the dots. And we also need to stop advertising because and stop letting patients just start to suggest drugs to their doctors just because they saw it as an ad or as an article, just because it has top of the mind awareness. That's not science. That is, I don't know what to call it, but when I find out, I'll also let you know. So guys, if you're watching this, thanks for joining me. Make sure that you please share this video, especially if you know anyone who has any issues with their menstrual cycle and how it can cause an increased risk for cardiovascular disease. Remember this, who has more cardiovascular disease, men or women? It's actually women. And then also share this video if you know someone who looks at this article as far as more doctors prescribing it just because there's an article about it. They'll probably get a laugh in regards to that, but something that they can use in order to solidify their understanding and solidify their belief that healthcare needs to change. So guys, be well, be blessed. I hope you have a great Wednesday night. We will talk to you guys very